eventually you were asked to become the founding executive director, I guess, of the National Food Service Management Institute down in Mississippi. When was that?
Uh, the the institute was authorized in 1989. The concept for an institute was accepted by the American School Food Service Association in 1977. We had a long-range planning conference, and one of the groups working in that conference said that we need to have a national institute. If McDonald's thinks it's important to have a McDonald's U, how could it be that we have 90,000 schools and we don't have one central place for training school nutrition personnel? Well, that idea remained pretty dormant through the 80s because we were going through another recession and an economic crisis in this country. But in 1987, ASFSA determined that it was time to ask Congress for something. We've been fighting, we've been defensive, so let's go on the offense. Let's ask for something positive. And ASFSA, under the direction, when Shirley Watkins was president, put it in the plan of work, and Jane Wynn was president then, when the provision was really provided to ask Congress to establish money for a feasibility study to see if there was a need for an institute in Mississippi. The chairman of the House Appropriations Committee was located in Mississippi, and the chance of getting the funding was much better if they went to that state. And the Mississippi had a strong school nutrition program. Yes. Great leadership, great philosophy, good rapport with school administrators, and a university, and they had provided a great training program for the state of Mississippi. So it was a good location. So that happened, and then in 1990, the funding was provided for the institute. And I retired from the Georgia Department of Education in 1991 and was fortunate. Now I think how fortunate it was that I was invited by the University of Mississippi to come down and help get the institute off the ground.
If you had one person who had the most influence on you over your career, who was that person?
That would be impossible to name. I could not answer that.
Okay.
Because, but I will tell you one that had a tremendous influence on me, that I worked with. Of course, when Kathy and I were talking about this last night, we talked about Meredith Garland O'Brien because her book and Emma Smedley's book influenced philosophy. But the person in child nutrition or in dietetics that influenced me very early on was Thelma Flanagan. She was state director in Florida, and she and my state director worked closely together. And when I was new in the State Department and new in child nutrition, Thelma had a long legacy in working with the Southern States Work Conference, developing policies for child nutrition. And I had the privilege of co-chairing one of the Southern States Work Conference with Thelma Flanagan. And there we, updated the basic beliefs, we updated the policies. And then she taught me how to look at many resources and look at the possibilities of applying those concepts or policies or funding or whatever, and partnerships. So I learned so much from Thelma.
All right. If you could speak to what the difference is between the field of child nutrition 20 years ago or 30 years ago and today, and what we see ahead, what would you say are the biggest changes, and what do you think will be the biggest changes in the future?
Well, I think probably the biggest change, the single biggest change in the child nutrition program came in the 70s, and that is when the system of financing was changed from an appropriation that frequently ran out at the beginning of a calendar year, and principals and superintendents no longer felt that they didn't have the resources to continue providing lunches to economically needy children. And the method of financing was changed from an appropriation to performance, so that that there would be a uniform way of determining eligibility for need, and then that there would be assurance of financing all year long. And at that same period of time was the expansion of the program to recognize that children did not only need food at lunchtime, but they needed healthy food all day long, all year round, and the program expansion that took place there. So I think that was a major milestone. I think we had another milestone in the 90s when the dietary goals were established, and we started implementing. We realized that it was more than just the nutrients that made a difference in healthy nutrition, and the RDAs really referred to the nutrients and not to things like fat and sodium and other electrolytes that we needed to be aware of. So I think the transition to see the total nutrition and food needs of children. Also, the other thing, we became very cognizant of the environment in which children had lunch. And we became, schools used to be so institutionalized. And now we're realizing that it's the whole child that comes into the cafeteria. And if we're going to make it a nutrition, health, and education, we also need to make it have a positive impact on their social practices.
Let's look at some of these pictures that you have. I'm going to bring the camera over here and see if I can get some pictures of your pictures and some of your memorabilia.
Well, there I was at the University of Georgia, and UGA has two campuses, a South Campus and a North Campus, and oftentimes we had to get to class from South Campus to North Campus just in about 10 minutes. And the only method of transportation was either we walked or we kind of hitchhiked with the people who lived in Athens. And it was a common practice for us to stand out and get a ride from one campus to the other.
Oh, and this is you out there hitchhiking.
There I am in front of my dormitory hitchhiking to the next campus. Well, my next picture is after I graduated from the University of Georgia. I just wanted to do a dietetic internship. And fortunately, I applied to several schools and was several internships and was accepted on all three. But I accepted Duke University dietetic internship. And this picture you see are the 10 dietetic interns.
Which one is you?
Which one is me? It's the one with curly hair.
Naturally curly hair.
Naturally curly hair. And we had a wonderful internship because the director and the faculty of dietitians at the hospital were absolutely wonderful. They encouraged us to think out of the box, to find out all of the resources there at Duke University Hospital, and to use our off time to explore those resources. All right, I attended the White House Conference on Children Nutrition, Food, Nutrition, and Health in 1969, and I was speaking before one of the work groups that day. And though I was one of the few representatives from the School Nutrition Association that was invited to attend the White House Conference on Food, Nutrition, and Health. Part of the legislation that was passed in that Senator Talmadge 91-248 established a National Advisory Council, and I was recommended by Senator McGovern and Senator Talmadge to be on the National Advisory.
Now, you're in this picture?
Yes, I am. Right there.
Oh, you're there. Okay.
There I am.
And there you are with President Nixon.
Yes. When the Advisory Council finished its first year of work, we prepared a report and presented it in hand to President Nixon. So that was a milestone.
If you had to give one piece of advice to young people considering child nutrition as a career today, what would it be?
as you're taking training, consider the needs of the whole child, that nutrition and wellness are an important part of the education of the child. So I would encourage young people interested in going into nutrition and dietetics and child nutrition programs to become master of the content, and then to realize that just knowing is not doing and not teaching, but you have to know how to deliver the content and the principles and the concepts in order for behavior to be changed. That a child nutrition director is a change agent. They are moving people from where they are to a higher level. And there is an opportunity in child nutrition program for a career path. So you may start at the entry level in a school and advance to be a manager, then to be a director or a coordinator in a school district, to go on to become a state director, to work with the U.S. Department of Agriculture at the regional or state level, and ultimately now one of our immediate past presidents, Justice Shirley Watkins, was recognized by the Secretary of Agriculture in one of the highest policy-making levels in any one of the major areas in the United States government. Shirley Watkins and Janie Thornton have both been elevated to those very high positions in federal government.